And a very good evening to you. I am Lisa Lord, and my special guest is the head of isolation facilities and infectious disease specialist, Dr. the Most Honorable Corey Forde. Good evening, Doctor. How are you?
Good evening. I am quite fine. I imagine that I've not been with you for a long time. It feels almost like a year,
Yeah,
Lisa.
it's been a few months. It's been a few
It's
months.
been a few months. It feels like much longer than that. With all that's certainly going on around in country, I would say that I would have had the pleasure to have a little brief leave, and on my return, obviously you know the numbers and countries certainly have increased or are increasing, and certainly for us, it's something that we're keeping an eye on. One of the things that made me sitting here today that really strikes me to my mind is I know Barbadians always get anxious to see numbers increasing, and I remember in our previous conversations that there was a lot of conversation about the numbers increasing. What do you do? Do things change? And I think just before I even start, just let Barbadians know, I'm not here to not talking about lockdowns. I think we're past that.
Hmm.
We're not talking about we're not having fear mongering. I think one of the things that was quite tragic, I think, in country is a lot of fear mongering when it comes to COVID-19. About treatment, about numbers of cases, etc. But I think what people need to remember is why was there concern certainly in the beginning? It's because we didn't know much about it.
Right.
I think we've learned so much um, over time, over the last 1.5 years, 2 years, we've learned so much. And then we got something in our arsenal that we didn't have before, which is vaccinations. And we recognize certainly from studies and etc. that the importance of mask wearing, for example, and recognize spacing was also an important component. Are those things going to continue? And what's going to happen with COVID? The truth is, Lisa, and I say here, I get some lashes for this, but that's okay. You know me, like to speak freely, and I think in general, like, COVID is here to stay, and we really have to figure, certainly as a country and as a people, how to live with it. But as I reflect on COVID-19 in Barbados, I just want to remind Barbadians that, and if I can look straight in the camera and talk to Barbadians, we have come through over the last 2 years a significant difficulties. And we have made it through. In fact, I think we've led the world in some of the aspects. Before most of the world decided on traveling protocols, etc., we made those decisions and they kind of followed. Before most of the world looked at how what is done in isolation and how we manage that, we actually proceeded with that. So I think we were way ahead. And it's because Barbadians, and I say today, Barbadians are very intelligent people. We know what's right and we know what's wrong. And we know how to make choices and good choices.
This is your third time on the program. Barbados is going through its fourth wave. What is different with this fourth wave in comparison to the previous three waves that we've had?
I think the first thing that I would say is different, certainly from the first wave, as I mentioned it before, which is that we have some in our arsenal that we didn't have before. I think the other thing that's quite different with this one is that this one spreads much faster. So we heard all of these different names. I think for the general public, you've been through the alpha and the delta and the gamma, and now we're at Omicron, and there are variants of Omicron. And the difference with this one is this one spreads pretty quickly. And if we think about BA1 or BA2, we talk about the subvariant, it even spreads even faster, which means it can get through your population quite quickly, which is tantamount to what we're kind of seeing certainly within our populations. But I say that, but I also would say on the other leg that we have the capacity to influence that by what we do.
Mm-hmm.
And I always, one of the things that I really thought, and I prayed, Lisa, you know how I am. I prayed before I came and I asked God to give me guidance as I talk to the people today. And I think that is me, and it will never change. But as I think about it more and more, I think sometimes God gives us wisdom and knowledge to impart to persons. And I think we have to let them make the right choices. I mean, if you even go back to, and I take it a bit different, you forgive me, those forgive me today, but simple things. When we think about, for example, Adam and Eve, they had a choice, and choice was made. And with choices in life, there are consequences. And I think sometimes those consequences can impact how things go. They can impact other people, can impact other people's lives. And I say that, and what comes to my head right now, I'm led to say, and to divert a bit, but to say that what was the greatest commandment? The greatest commandment was really to love each other. And I think if we're going to do things that are going to impact other people's lives, then, that is a challenge. Everything we do, I think, should be out of love for each other as a country. And we also have to recognize that what we do in that aspect, whether it be, we wear masks when we're supposed to do that, we appropriately space when we're supposed to, whether we get our elderly population out, which is something I really want to talk about today because it's dear to my heart, whether we get them out and get them evaluated at one of the evaluation facilities, I can discuss that more, whether we move them from a state of vaccinations into getting boosted, it will all impact not only their health, not only people's mental stabilities if someone dies, but it also impacts our healthcare system, impacts, Lisa, all of these persons who are in here today. It impacts all of these individuals who are on the other side of this fence today, who work from day to day in the trenches, day and night. And I worked all last night, so that's why you came to see me today, down this side. So it impacts all of this. So I think the decisions we make in life impact so many other individuals. And I think that's one of the things I really want to discuss with Barbadians today. I'm not here to chastise Barbadians or to be angry and upset, etc. Numbers, because I am going to sound strange, Lisa, but I don't follow numbers. I follow the number of individuals who get ill. I recognize with this particular variant that the numbers could be high, and people get anxious. They see, and I want you to get rid from that anxiety. Don't be fearful. We need to act appropriately. We see numbers going up in 600 a day or 350 a day. You see it drop to 200 and you feel good, and then 3 days later it's 700, and this anxiety in the population. Don't be anxious. I think that's one of the things that's really taken the world by storm, the anxiety with regards to COVID-19. I think we need to change that narrative. I think the staff have learned, in terms of working on the ground, that sort of anxiety that they had before with going into the unknown. I think that has changed because they understand. They're vaccinated. They understand that you're probably less likely to get into trouble. So they understand that, and they will react accordingly. Before we would come in these huge white suits, and we do that for certain circumstances, but we've learned that that might not be necessary. It's costly, and now we know it might not be necessary. And so we wear, the protective equipment that is required to enter. And I'm sure we'll have the opportunity to probably enter today. I'm not sure, but I figure we would. But this is where we're at. I think one of the other things, one of the things I really want to get at today is over the last few weeks, we've seen that increase in numbers. But what is troubling to me, Lisa, and I would always be me. I tell you something, everybody in Barbados public probably knows a bit of me, and that is, I grew up with my grandparents, and they were very dear to me, and it's kind of hurtful to see many of our elderly population so ill, and the question is why. So I could tell you, for today, we have about 20 plus very elderly persons, so people above the age of 80, right? So for you who are less than 80 years old, I don't consider you to be old, so that's a good thing. But 80 years or older, most of them bedridden, most of them who can't walk and go to the supermarket and usually don't help themselves. People do things for them. We have a lot of that population here, and 20 or so of them who are extremely ill. Many of them have comorbidities, diabetes, hypertension, few with cancer, etc. Some with a bit of kidney impairment. And when I look back at that, there are two things that strike me, Lisa, two things that really strike me. One, I'm appealing to Barbadians. Notice the word I use. And you just say beg.
Yes, you do.
But I'm appealing to Barbadians. When I talk just now about loving each other, I'm appealing to Barbadians to bring them forward pretty early. If they're unwell, bring them to get assessed. And the system has changed, Lisa, from the beginning. For me, if you really think about what we did in the beginning, we've really curtailed the system according to what's been happening. And we've created 2 assessment centers. And I think we probably didn't do justice in talking a lot about those assessment centers. And I'll use the opportunity to do that. So assessment centers are, so people get an idea of what they are. So you don't go to assessment center necessarily you're admitted. You go to assessment center if you think something is wrong or you're not sure, or you had a bad cough or cold and things don't seem right and get a bit of chest pain with it, or you're asthmatic and you're wheezing, you go to get assessed. The guys will look at you, whether it be at the Forde Hospital there in Belleville or as far as in St. Philip, to capture that population of individuals. You go there to get looked at. The guys will look at you, examine you, check your vitals, figure out very early on what your risk is for getting worse. And if we think, we're not so sure, we think you could probably progress in the illness. And we have people who come in and spend 3 days, 2 days, 24 hours. Some people who came in, we assessed them, we gave them some medication and sent them home. And I'm especially clean with Barbadians and is asking them as caregivers within households, if you have elderly people and they are well, take them to the assessment center, to calling the operations center, and get them seen and assessed so we can try to figure and try to save some of the lives of some of these individuals.
Now, you would have mentioned numbers. We've seen the increase in cases over the past few weeks, but we've also been seeing an increase in the number of deaths as well. We're now past 400 deaths.
Yeah, and every single death, and I know Madam Prime Minister always says every single death wrenches the heart. And for me, working here and working in the full system, whether there's a death at home, which has happened, whether there are deaths in facilities across the country, whether it be geriatric hospital, whether it be QEH, whether it be the emergency department, whether it be here at Harrison's Point, where we host the most sickest persons in this country, whether it be at any of the other even assessment centers, they all mean something. And you would remember the deaths, you say the deaths certainly are 400 plus. And if we think about that, before, I just want to divert a bit here to say, look, before the vaccination campaign, we had individuals dying. After the vaccination campaign, those deaths continue. If we look at that data, and I think, sometimes when you talk to the public, you have to give them the data. I think the data allows people to understand what's going on. And, the interesting thing about it is that out of that deaths and that population of deaths, there were about 68%, 68%, which represents about 19% of individuals were fully vaccinated or partially vaccinated. And people say, well, see, vaccinated people are dying, or partially vaccinated people can die. But there are 3 points I really want to hit today with regards to that aspect. One, and I always believe people have a choice. And I said it before in this presentation, but choice is important. But with choices come consequences. And that is something that people have to understand. So if you look at that population of individuals, and I have the responsibility of managing a lot of these individuals, many of them had multiple comorbidities. And I would dare to say, without giving out medical information, it's so difficult sometimes because you have to muster between giving people's medical information out and not, and how we do things. So yes, many of them had multiple comorbidities. These I'm not just talking about diabetes or hypertension, talking about end-stage kidney disease, for example, talking about even cancer. Some people had stage 4 and stage of cancer. So it was very difficult, and it was very difficult on us, and it was very difficult on the staff, for example. But I think that's important to say within that particular population. But the other part, which I really need to drive home to Barbadians, and before I actually give you a bit of figures for our elderly population in this particular outbreak in terms of deaths, is that if we look at that population as well, those who were required to be boosted or required booster shots. You know, everybody knows what a booster shot is now. It's been all over the airwaves. They really didn't have their booster shots, which puts them in a a more ticklish situation. Even though they have their 2 shots, they really need to be boosted to be efficiently fight against the virus, especially when you're fighting against cancer, especially when you're fighting with kidney disease and diabetes and hypertension, and all the other comorbidities that anyone can potentially think about. You have to have all of those, every single thing in your arsenal to fight certainly against this virus. And this at all is not fear-mongering. I mean, if we look at our death rate, and I'll say it, and I think we don't want people to die, and we'll do everything in our power to do that using the knowledge that God has given us, and given the science knowledge which we've had, and we don't want that to happen. If we look at the deaths in Barbados as I speak, to be frankly honest with you, 8 out of every 10 deaths were among the unvaccinated population. Those are the figures, and that's the reality. And I think that that's important to know. But when we then look, and for this outbreak, and as I say this, and I know it's windy outside right now, Lisa, I almost get goosebumps because I just always think about, and I always say I have a special love for older people, and I think it's about loving each other and loving other people who are in a more helpless situation. There are caregivers, and then there are caregivers. What do I mean by that? Caregiving could mean feeding somebody and making sure they eat and they're fine. But then there's the other part, is about ensuring they're fine in all different aspects. I want to congratulate Barbadians today on one point. If we got 80% of our vaccinated population over 70 vaccinated in the first part, when people were afraid, Lisa, that was brilliant. And we didn't see the massive amount of deaths in the elderly population. Yes, some elderly people died in that genre, but it wasn't massive. And I honestly believe it's because Barbadians heeded the call. You know why? Because Barbadians are very intelligent people. They know what's right and they know what's wrong. But I think as people became more comfortable with COVID and the reality that this is what we have to live with and we have to figure our way around it, I think we may have forgotten that population of individuals. And I'm asking caregivers at home, for your grandma, grandpa, great uncle, great nephew, the people who brought you up, the people who, I can say for myself, who would drop me off at my grandparents for me to stay with them. Well, my father had to go to work, or me and my sister, for example, who I always talk about, well, they had to, to be working and go and stay by your grandparents, or you lived by your grandparents and they took care of you, and your grandparents loved the grandchildren, right? But now they're older, we have to still look after them. There has to be a sense of morality when we're looking after them. And I think part of that does not only mean making sure they eat and they have a comfortable place to stay, but protecting them. And how can you do that? How can you do that? And they say it's almost a point. I'm sitting here and I'm almost have tears in my eyes as I talk today, because I think there's simple things that we can do to help them from having to come here. And one, get them assessed. If they're sick, if they have diarrhea, they have vomiting, don't keep them at home and hope it goes away. And I'm going to tell you, I know Barbadian older population. I love them, but I know them as well. Some that can be stubborn. I live with my grandparents, and I know they can be stubborn at times. But you have to get them out. And if they're listening to me today, they also have a responsibility as well to get assessed. You don't necessarily have to admit you. You just check in to make sure that you're okay. And if you're fine and we think you're going to be fine, we let you go home. If we think you can keep up with your fluids and don't end up with kidney problems, which a lot of them end up with, then we'll get you back home. The other part, the two other parts I want to talk about, we need to get them boosted. We were good at the first part. All of you, Barbadians, you were good at the first part of this in helping these old people to get past that first and the most wickedest part of this pandemic today, Delta. And now it's your responsibility in this part where most of you are getting mild to moderate symptoms. They are taking a brunt of the challenge. And I'm asking you, please, to consider not only for yourself, because you might not want to get boosted, but consider those older people in your house. Look back and see when they were last vaccinated. Go and make sure they get their boosters. And if they had their booster and they're due for the fourth shot, which is now in vogue, Lisa, I'm asking people to think about it. I've always said everything in life is about choice. I'm not here to force anybody or compel anybody to say you have to get this or that. But I'm asking you to live with love in your heart and make the right decision for that individual, because that doesn't only impact them and your family, it can impact a whole healthcare system, and it can overrun a whole healthcare system, and it comes at a cost at a time in the world where things are choppy, right? I don't get involved in politics, you know, but there's a time in the world where things are choppy in terms of cost, in terms of livelihood, etc. And really, really, really have to take care of those who are helpless among us. I think that was the greatest commandment, is to love one another. And I think in loving one another, we take care of people. We check in on those, because every old person, some people live at home by themselves. And then the next part of it, Lisa, to finish off this particular part, which the average person sometimes doesn't think about. I know people want to party and have fun. I tell you, don't party and have fun. You have your fun. You feel as though you've been locked up, Lisa, for a long time, and you couldn't go to a party, you couldn't go to a fete. But many of these people I have in here today don't go anywhere. They don't leave home because they can't. They either have bad arthritis in the knees, they get bad rhythm because they had a stroke, or more, they don't go anywhere. Who brings it home to them? You know, who brings it home, Lisa? It's those who can move around the society that bring it home. So if you have an old granny at home, be cautious with them during this period of time. Wear your mask around granny or grandpa. I always say granny, so forgive me. Or grandpa or great uncle. Wear your mask around them. Make sure if they're interacting with you and they could do it, make sure they wear their mask around them. I think it's those things. And for those caregivers who are ingoing caregivers, so there's some people who go and take care of the elderly population in Barbados, has a really good, I think, in-house program. You know, for instance, the National System Board, if I got it correct, they go and try to help some of these elderly. Even for those people who are going around, you know, people, some of them might go a party, might have fun, they might have kids at home who go out to party and might come in contact with COVID. Consider that when you're dealing with the elderly population as well. I think that's important. And I want to make a special plea, Lisa, to nursing homes today. So there are many nursing homes in Barbados, and sometimes, you know, people are not able to take care of their families like they would like to for some other reason, but they still go and see them and etc. And you even go to the nursing homes, if they're visiting allowed at those nursing homes, I'm asking you to use the appropriate measures. You know, normal hand washing, wear your mask when you're around those who are helpless and can't help themselves. And for those who work in the nursing homes, I encourage you, and I know you do already, but I want to further encourage you today to wear your mask when you're in the population of these individuals. Recognizing that whatever is in the community, Lisa, whatever is in the community in Barbados, we will see in our churches, we will see in the same Chefette and KFC that you go to, or you'll see in your gas station, you'll see in your nursing homes, you'll even see in the hospitals.
Now, Dr. Forde, we're here at the Harrison Point facility. There's still a lot more that we need to discuss, but we also want to get a glimpse on the inside. So we'll take a break here. Stay with us. You're watching One on One.
I am Lloyd Gollum, artificial inseminator attached to the Pig Improvement Program in the Ministry of Agriculture. There is a deadly disease lurking on our doorstep. The African swine fever, the ASF, has been detected in the Dominican Republic. This disease is deadly. If that disease strikes, all your pigs can die. For those farmers who usually utilize the traveling mower, both the farmer who receives the traveling mower service and the farmer who operates the traveling mower service must keep their premises clean, disinfect regularly, bathe that animal, keep that mower in a separate pen, if possible downwind from the rest of the herd. When operating the service, take along with you a basin, your brush, and your soap so that you can disinfect before and after. There is a safer alternative. The Pig Improvement Program offers insemination to the general public. And you can get more information about this by simply calling the Ministry of Agriculture 535-5958, 5957, or 5956. When feeding or dealing with your animals, have a set of clothes that is worn only for that purpose. If you're going from your farm to somewhere else, remove those clothes and wash them regularly. Do not feed swill. Swill is all these scraps and pieces of potato peeling that is left over after you prepare your dinner. If that swill contains infected meat, it can bring that disease onto your farm. We have to be very careful. For this disease, there is no cure, there is no vaccine, there is no treatment.
Help us keep African swine fever out of Barbados.
Hi, I'm Dr. Adana Grandison, and I'm here to give you a few tips on how to accurately and safely take your blood pressure readings at home. Before taking your measurement, sit in a calm, warm environment. Don't perform any exercise in the preceding 1 hour. No coffee, food, smoking, or even sinus medication in the preceding hour to taking that blood pressure reading. Empty your bladder and bowel. Most readings that are taken at home should be below or at 135 on 85 millimeters of mercury for uncomplicated hypertension. Lower home blood pressure targets might be advisable in persons who have the following conditions: diabetes, chronic renal disease, or coronary heart disease. If several readings are above 140 on 90 millimeters of mercury, make an appointment with your physician immediately. Ensure to take your readings at the same time every day. We advise 2 readings in the morning and 2 readings in the evening, initially to profile yourself, taken 1 to 2 minutes apart. However, once you have established a baseline, you can choose a time suitable to your schedule where you can monitor your blood pressure readings.
Welcome back. We're now suited and inside of the secondary high dependency unit. Dr. Forde, what is happening within the primary, tertiary, and secondary units here?
Right. So at the facility at present, we have 111 positive patients within the facility. We have 1 negative individual that's a caretaker of somebody who opted to come to assist, and we do allow that to happen in the facility. In our primary isolation area, we have about 21 or so individuals. One of them is ventilated. One of the encouraging things, we were able to get at least 2 people off ventilators recently, and they're back home present with their families. One was transmitted back to the QEH for continued care. Here on the other side, primary B, which is the area we has closed, Lisa, for a very long time
That's very long.
Very long, months.
Okay.
Until this surge occurred, this real surge of the elderly, as we've spoken about before, has come, and we had to really open up that unit. Needless to say, we do not have a capacity problem at all at this point. I think we have Plan A, Plan B, and Prime Minister always say have Plan F, C, and Z. So we have all of those particular plans in place if we needed to do any escalation at all on the facility. And more facilities still active, and the 2 assessment centers, which I've mentioned before, are still active. This is our
What would
secondary.
be the number for you
Pardon?
to break your capacity here?
Right, so about 200.
200,
So if we got up to 200 or more, the capacity here will be broken at this facility, but we have excess capacity at Labour College, for example,
And the Sparman Clinic.
and Sparman Clinic,
Okay.
and the Amore facility
Right.
as well. So we have that backup in place, and then we need to escalate further. I've been given the assurance by the minister and the others that whatever has to be done in the interest of every single Barbadian, that will be done.
Do
But
you
this-
anticipate something like that happening?
It is difficult to say. I think people's behaviors become very important. And I think people heed the sort of things that I've spoken about in the first part. Without fear mongering, without being anxious. If you just do what you know is right, then I think that we'll be okay. I don't ever like to do predictions. The only person who could do that is the Father. But
It's true.
so, like I said before, this is our high dependency unit. This is where we have many of the elderly who are ill, which you spoke about. You've seen for yourself, Lisa, on camera, right? Just know the inside, we can see everything that's going on. This is a really new area.
And that camera setup we saw, that's new.
That is absolutely new, genius, really. This certainly at the governmental level, in trying to making sure that the Barbadians had an extra capacity of ICU beds to provide the care and oxygen, all the fancy things you'll see in any ICU is the things that we have here. So that was created in Alpha Delta and is now serving us again during this Omicron surge.
The age of the youngest person here.
I think the youngest I may have today maybe a 44 years old in this unit. The oldest up to a few days ago would have been a 104-year-old, and she's made it back home with her family, and I think that's amazing. You had a 101-year-old just before they made it home, all vaccinated and boosted. I think that's strategically important for people to recognize. And of course, we hope that I think the message I'm trying to get across today, help protect our elderly population, will be really be heeded by Barbadians.
Indeed. Thank you. The doctor was removed from the secondary high dependency unit to primary isolation B. What is happening in this particular unit?
So this particular unit is where we house our most sick people in country. It's the unit. We have the capacity to do that on the unit you just left, and the one just opposite this to ventilate individuals, put them on oxygen when necessary, etc. And to dialyze people, Barbados is there's lots of NCDs, diabetes, hypertension. I'll speak about that a bit later. But on this unit is where we house our most sick individuals, including some of that those in the elderly populations with multiple non-communicable diseases. And I think I take the opportunity at this point to say one of the things that also touches me is that during the pandemic, many people have not followed up for taking care of the hypertension, taking care of the diabetes. They may have had kidney problems before, and they've not taken care of those aspects. So really also encouraging Barbadians, as I encourage them, all the other things I've said, to look after that particular aspect as well. Because if you do get COVID and these things are off, it makes life for you much more difficult, and you may end up in this unit. In this unit today, we have 2 young individuals, less than 40 years of age, with comorbidities, for most part, which were in most cases uncontrolled. So these are all important aspects of COVID as well. So you may get COVID, but if your things are off, your sugar is off and your pressure is up, and you have kidney problems, for example, or you have other illnesses like sickle cell disease and all the other aspects, it makes life a little bit more difficult. I say that, but in the same like what I say is that people with those aspects are the ones that we really want to step out and to stand up for themselves about getting cured, getting treated for these illnesses, but also being appropriately vaccinated.
The Ministry of Health and Wellness recently started offering a second booster to persons 50 and older or immunocompromised.
Yeah, but we're pretty low in that particular component. But what I actually say is, if you look back at people who had the first booster, there's only, again, going back to the elderly again, about 50 or so percent of them, or just around that range of them have done that. So there's still leverage even for the first booster. So even before we get on to the next booster, we just want to make sure that people are appropriately boosted down the line. But yes, people are aware of it. They've seen it on TV. They've seen it in the US. They've seen it in some of the more metropolitan countries where it started. And Barbados, certainly, we will never be left behind. As I've said before, we've always been in this particular pandemic, which we never faced one before. We've always been leading the drive. And I think here we are again doing that. And again, I'm encouraging Barbadians to think, to stop, think, and go. Stop, think carefully, and go forward.
Can we still say that after 2 vaccinations that you are still fully vaccinated?
Yes, this has always been certainly a large discussion. And we know, right, the science is there that basically says, look, if there's a situation, for example, where people have had their first 2 shots, and then there's a waning period, right? There's a waning period, and you don't get your second vaccine, you don't get boosted, then your response to the infection is going to be not, as it might have been if you were pretty early on in that vaccination phase. So getting the booster allows you to have that extra, I'm trying to make it as simple as possible for the listener, that extra boost in response to any infection you get. And those individuals are less likely to end up in this particular unit.
We saw several wards at the Queen Elizabeth Hospital impacted by COVID in terms of it spreading to patients. I know that you were called in to deal with that situation. Yeah. What is the status update there?
Right, Lisa. So I'm like the man for all seasons, but my strength comes from the Father above, and many people in Barbados who continue to pray for us in a difficult situation. And from a very strong team that stands on my left at this particular point. Right at my particular point, sorry. So the status situation at QEH, and I think by the time this airs, things might be different. I think people need to understand that. But in general, as was said by the chairman of the board, who has been extremely supportive in the hospital venture, but I think you have to understand the board and management hospital really has supported this particular unit here, and you really need to state that so the general public understands the importance of that support at the hospital level, at the Ministry of Health level, and at the Emergency Operations Centers level. I think they need to understand that is where all the support for this facility comes from on a day-to-day basis from QEH. But the status report basically is low. C5, C6 had some issues with COVID and B5, and they're all happening simultaneously. But before we even get into that discussion, what I would like to say is something very important. Whatever is in your community will end up in your community. And this community is the hospital community. It is how we handle it, it's how we try to prevent it from getting there. Barbados has been one of the most successful, probably one of the only countries in the world, from my knowledge, at this particular point that I can think about off the top of my head, was really trying to keep their hospital COVID free. And we have been almost perfect at that in terms of having massive outbreaks in hospital. In fact, I would say in the Delta range and the Alpha range, we had more cases with any hospital from popping in and out than we probably have now. But needless to say, it just required us to tighten up a few things to continue the educational program. We were able very quickly, I took my team from Harrison's Point into QEH, and we were able to quell that. So basically, C5 and C6 have been handed over. B5 has been handed over, COVID-free. And happy to say, and I'm sure it'll come out before I say this, but B7, which is the word of concern, last word of concern, has also been handed over. This morning we will get some results out of C10, which is another ward which had one person coming out of it. The tests that were done yesterday are to be out this morning. I expect them to be okay, but we've already put measures in place. I expect probably by the time of airing in this for us to have handed back over that unit as well, if not today, early tomorrow. So I think it really speaks to the sort of ingenuity of the staff, the diligence of the staff on these units, and they continue to function and work in a very difficult situation. I think they all need to be applauded. I also think, as I speak about this and be really, really clear, I said it again, I'll say it again, is that none of what you see happening or the efforts could not have been done unless the leadership of the hospital was there. And that's just something that I think needs to be applauded in a difficult situation. Despite everything else I've said, I think the support, even in this difficult situation, even with the other situation, having to move here, the support has always been there for us. And I know my staff is tired, and they're very tired, and I have to deal with that almost every day. And we have different ways we do to encourage them. As I try to encourage Barbadians to do those things which they know are right, Lisa. And you really can't see my face, I guess, that well. But I'm really encouraging them to really take heed of all the things I've said. This is not a fear-mongering event. I don't believe in that. I don't believe in all the fear-mongering with COVID and stuff. I just think you need to do what you need to do, and keep us on the steady path that we have been on. We have come through harder points. I remember standing on TV with you and speaking about the storm that was coming, and the storm came, has left, and we are still standing. And I think we have another opportunity today to show the resilience of our people. And the resilience of our people, to my mind, will come through them doing the right actions. And not only looking after themselves, but thinking about others who can't help themselves. And I think anytime we get to that point in life where we can just focus on helping other people, right, apart from ourselves and our own families, and understanding that what we do, and I speak to the young people today as they go and party and they have their crop over and enjoy those things, and that's fine. And you'll never get any pushback from me where that is concerned. But the thing is, you do it responsibly. All of you are responsible people who are listening today. And when I spoke to you today about boosting and making sure these elderly people get boosted, so they hear them coughing in the background and unwell, it is hurtful, right? Especially when they can't go anywhere, right? You need to focus on that. When you hear me speak about, even if for some reason they can't be vaccinated, because that can happen, right? You can't be vaccinated for some reason, or for some reason that you choose not to get them vaccinated, and be careful about your choices. Then you need to wear a mask around these individuals. They can't defend themselves, right, like you could. And for those who are at home in that elderly population who have diabetes and they have hypertension, and they may have a little bit of kidney problems here or there, right? And they may have sickle cell disease, or even though they might be a little bit older, if they got that older, they have any of those other comorbidities that you hear about, wrangling about the media. I'm asking you to make sure that they continue that care, they continue taking their medications at home. You know why? Because even if, God forbid, they got COVID and their diabetes is controlled and their hypertension is controlled, although, the outcomes are a bit different, if they're controlled, it makes us managing them much easier because you're not fighting 10 battles at once. And then there are those who are elderly who may have cancer. And that's the stark reality of life. They may have cancer. Again, getting them vaccinated, and yes, we did that. Brilliant, I told you in the first part of the battle. This is the next part of the battle that we need to do with to get them appropriately boosted. And if we can, maybe we can save a few more lives, even with people with cancer. We don't want them to die because of that. We don't want them to die because of COVID either. But whatever happens, Lisa, be assured, and I assure the general public, as I look at the camera today, that we will continue to do our best in this facility to save as many Barbadians as we can. But we cannot do it on our own. We need your help. All the things I mentioned, they want you to sit down and talk to your family, talk to your grandma, talk to your grandfather, talk to your great uncle, talk to them. I'm not here to force you or to tell you this is you have to do this or you have to do that. I believe in choice. I've said it a million times on this tape. I believe in choice, and everybody has the right to choice. But with choices come consequences, and consequences sometimes will not work in our favor.
As Barbados battles this fourth wave, your biggest concern at this time?
My biggest concern is people becoming complacent, and you've seen it all across the country. I think, to be frankly honest, that Barbadians are looking to see what's happening in other countries, and I think they're reflecting to see why are we not doing this and not doing that. But I think we need to reflect to see what the status of those countries were months ago, what the vaccination status was in those countries and the populations which spoke about today. We need to look and see what the healthcare systems are and what the massive challenges that they have faced 2-3 months ago, even in this particular wave with the increase in cases. We need to look and see what they're doing within the communities, but then what they're doing in areas where people are vulnerable, like the nursing homes or hospitals. And you'll be surprised to see that the same measures that we're doing here, they're doing as well. So the average Barbadian may not know that. And like I told you, I just spent 4 days on holiday, much needed holiday, and I was able to go to see what they were doing in their hospitals, despite the different mandates which have changed, and those things are being maintained in those areas. And the question is why? Because that's the most vulnerable populations, and that's where they will wreak most havoc if they get it wrong. So I don't want Barbadians to become complacent. At the same point, I'm not here to to tell you, hey, do this or do that or whatever. I'm here to just tell you that how you got through Delta. You know as a country how we got through Alpha. You know as a country how we started to get through Omicron before this other wave. And truth and reality is reflection, right? If we reflect and look back, we will recognize very quickly that what we've done before, we will do again, or we can do again, right? And that this is the start reality of the situation, that we will have to live for this, and we will have to get back to normalcy with this in place. And this is exactly what's happening in this country. But I think the small things that we do, the small actions that we take, like wearing a mask, which you probably hate me here saying, or get vaccinated, which you probably doubly hear me here saying, or get boosted, which you probably all also hear me say. But these are the things that the start reality of life is. Those are the things that may change the platform which we stand on today. I think that that's important.
Dr. Forde, thank you so much, as always, for taking the time to talk to us. You and your staff for inviting us here to Harrison Point. We really appreciate you talking to us.
Yes. It is indeed a pleasure. And before I go off, I have one last point to make. Asking Barbadians today, remember this mantra: stop. When you're about to keep your mask off, or run around, or you're enjoying yourself, and you're in the midst of other people, stop. When you're in the midst of your grandma, grandfather, great uncle, they can't help themselves, and you went out partying, you're coughing and spluttering, stop. Think about what you do. Because what you do could impact every single other Barbadian. And then go, right? Go, hand sanitizer, go, wear your mask, go get vaccinated, go get boosted. Thank you.
And thank you. That was the head of isolation facilities and infectious disease specialist, Dr. the Most Honorable Corey Forde. I'm Lisa Lord. Thank you so much for watching One on One. Do have yourself a wonderful evening.